For all of us, the calm before the storm is the most important part of responding to any crisis. Whether the storm comes literally in the form of inclement weather or results from an infectious disease outbreak, when an emergency arises, preparation and training in the period prior to any crisis can make all the difference.
The first pictures we got back of Sandy, I think, shocked all of us. The devastation was unbelievable. But we aren't in this alone. There are a ton of healthcare facilities and other hospitals that are going to need our help. We sent scouting teams down to the Rockaways to get into the nursing homes and try to paint a picture for New York State of just how devastating the storm had been. And then we started getting a request from New York City Emergency Management. Can we help with the evacuation of Bellevue and NYU hospitals? Here we are in Midtown Manhattan, and the water's rising. So we were able to mobilize our transportation resources, our nursing staff, as well as our physicians, because Lenox Hill, our hospital in Manhattan, took a huge influx of NYU patients. The health system as a whole was able to meet the demands of any request that came in. We didn't flinch.
Mother Nature and infectious disease outbreaks can be unpredictable. When the public turns to its healthcare institutions in times of crisis, hospitals and emergency personnel need to be prepared.
The facility that was built here at Glen Cove was built specifically because of the Ebola issue, but it was designed to handle any type of serious transmittable infectious disease that would be a rare disease that would require a lot of intensive care. We've done a lot of training of our staff, and the main reason is, again, it's all about staff protection. One of the tenets of emergency management is that you have to protect your staff, because if you don't protect your staff, there's no one to take care of the patients.
What we learned from Dallas and what we've learned from Doctors Without Borders in Africa is that to care for somebody on a day in and day out basis, once the diagnosis is made, does require a special unit. It requires people who are trained to do this. It requires a different setup. It requires an area away from other parts of the hospital so that people are not nervous or scared if they are in the hospital.
The hope is that our area never faces another crisis. However, that is as unrealistic as it is dangerous. Lack of preparation is a recipe for disaster.
You can drill, you can sit around a table, and you can talk about scenarios all the time, but until you have to put on one of these suits and until you have to actually get out there and physically cut somebody out, hose somebody off and bring them through, you really don't feel what the labor intensiveness of the whole effort is. Every hospital has a setup like this by their emergency room. They have staff in their hospitals that are trained to set that up.
I mean, we want our communities to be prepared.
Always be prepared, the Boy Scout motto says. To help better protect our communities, healthcare institutions around the country have taken those words to heart.